All right, all right. So as we begin, I'll be sure to bring up our speakers. But first, I want to welcome you all to Preemie and You, Understanding Preemie Care and Support for Mothers. We have an amazing group of ladies that are going to share their journey with us and offer some support and guidance about this very important subject, as I mentioned earlier. Before we begin this discussion, we always want to give honor to the 5 co-ed women that thought of us to begin Zeta Phi Beta Sorority Incorporated. In what a vision they had at a time in 1920 when having a vision for women might not have been possible. So our first speaker that we're going to have sit with us and discuss her journey is Miss Faye. And a little backstory, Faye, I always call her my mommy partner. We had our boys at the same time. We were set to have our boys at the same time and take this pregnancy journey together. She is a passionate project manager with over a decade of experience in the financial services, nonprofit, facility, and insurance industries. She is currently married to her husband of 10 years and has 2 sons, ages 8 and 3. Her youngest son was born 2 months early during the pandemic in London, which presented a unique set of challenges and rewards. She is currently navigating the complexities of modern parenthood while maintaining a successful career. She's a strong advocate for work-life balance. She is an active member of her community and is always looking for ways to give back. And she is currently a supporting director for a sewing group, CIC, in Kent, UK. So we welcome Faye. Thank you for joining us.
Thank you, Amani, and thank you, Zita, for having me. And so, in terms of my journey, having a child that is premature during the pandemic, let me just say this before I begin. I'm slightly biased on this. Reason being, my husband was born at 26 weeks. And if you were ever to see a picture of him, it will present no fears. If he was born at 26 weeks, then it kind of reassures that, okay, and with no problematic long-term issues whatsoever, it gives you that reassurance. But it does give you a different perspective when it's your very own, a child that's come from your loins, as so to speak. So in terms of the journey and how it came about, during the pandemic, my waters broke early. It was a day before my first son's birthday, and when I say waters broke, it was treacling. And so I had called my midwife that's assigned to you to check you out. Probably different terminology. I'm sorry, I'm not a medical professional. So in terms of it being called a midwife, I just know it was a midwife type person to contact them on this subject. And they had said, come in right away. However, your husband can't be part of the checkups, I'm afraid, due to the fact of keeping a safe distance during the pandemic time. So all of the scans, all of the checkups was done solely myself, with him being on video. And so when I had checked myself out, my baby was almost acting like a plug. So even though there was some liquid that had escaped, it was still fine. And what they wanted to do was to admit me and just make sure everything was fine. So I was admitted. And then my son's birthday came about the following day. I said, I must be discharged. I've got to be there for my son's birthday, considering he's been part of this pandemic journey. And at the time, he was about 4 years old. So I said, if any changes whatsoever, I promise you, I will come straight back to the hospital. And so they managed to allow me to be discharged. I went to go and celebrate my son's birthday at home, and return back to the hospital that very same evening. Um, I had said to them that I'm having some contractions. They said, don't worry. They checked it out. It's just the baby moving quite, no, dramatically, that it's okay to return back home 2 days later. If anything changes yet again, come back. The reason being we need to save the spaces for those that are literally immediately in delivery, or active labor, as they call it. And so I returned back home. And then I said, no, 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 no. This is labor. I know how labor feels, even though the baby is at the time 7.5 or so months. I know what active labor feels like. So I went back to the hospital and I said, no, you're not having a baby. I said, no, I am having a baby. I'm thinking, I'm making the maths. If it's slightly smaller, it's gonna come a lot quicker. I said, please admit me now. And I've gone to the one of the best hospitals in London called King's College Hospital. I don't know why I signed myself to that hospital. Within London, you can have the power to assign yourself to certain hospitals, depending on what borough you're in. And I had a closer one, which is 2 minutes away. But I don't know what I thought about in terms of the journey of this. I just knew I had to be in King's College. But I can see now it's only God that allowed me to be in that particular hospital, because they are a specialist if you are going to be admitted into neonatal ICU level 3. So I was admitted, the baby came. However, there was silence. There was silence when I had a vaginal birth. I had the first one was C-section, so this is my first experience of having a vaginal birth. And there was
Mm.
silence for that split 3 seconds, and that was the longest 3 seconds. I'm like, I don't know what I'm having. So what am I having? I told
Mm.
my husband, tell me what I'm having, because I have a surprise for my birth. He said, you're having a boy, but I couldn't hear no cry. So I'm like,
Oh gosh.
okay. And my husband's like, he's silent and he's a bit squeamish for
Mm.
blood and everything, but he's just silent. I'm like, you're meant to be reassuring me right now. So what's going on? And so they said, we're gonna try a new technique, which is not allowing the baby to be on like I think they emit steroids, please. If there is any professionals, I don't think there's a particular technique that they do for neonatals, whether they admit sort of steroids and then they'll put them onto a particular breathing machine, but they're trying not to allow the baby to be dependent on that breathing machine if possible, so they can breathe on their own. My child started breathing on their own after 15 minutes. So that gave me the
Oh.
first set of reassurance, and rushed off straight to the neonatal area. So I can hear the little one now screaming. So in terms of just probably fast forward, and sorry if I'm speaking too long. Should have minted me, Amani, if I'm speaking too long on this. I can speak forever. But one of the key things that happens once you're finished up, they put you back onto the ward with other mothers. You're hearing the cries of other children. Um, I can't explain the feeling that I was feeling at the time in terms of the upset that I'm not carrying my child. And obviously, being a mother of my second child, I know how that first feeling felt. I'm like, even though my husband was allowed to be there, but only for a short period of time because of the pandemic. And as soon as
Yeah.
he leaves, I can go and be with him for a period of time, but I have to return back to my room. So I felt like he was alone. And I'm like, I can hear the cries of other
Yeah.
babies. I don't know what's happening. I'm asking my husband to keep me in touch, keep me informed. They said, okay,
Mm.
we're packed. We're over the quota, I'm afraid, at this hospital. I was like, okay, so what does this mean? We're
Yeah.
going to have to find another level 3 hospital tomorrow. I'm like,
To
okay.
send you to.
To send, not me, the baby to, because it's full where they are. They said, I don't know what's going on in the water, but there's been so many early pregnancies during the pandemic, and they can't put it down to what particular science, but it might be the fact of I wasn't mingling with anybody, whether my bacteria, or, it's good to have a
Mm.
bit of bacteria for your immune system. So I don't know what
Mm.
it was, but there was a lot of early pregnancies at that time. And where they want to move to was far away from home. I'm like, that's London traffic. It's just, it's mad. So I said,
Yeah.
wherever he's moving to, I want to move to. I'm afraid, mother, since you are fine, you cannot be with that baby. So with your baby, so you have to travel every day. The next day, they said, your baby's doing very well, so well that you can go to a down category, level 2. Level 2 was 2 minutes away from my house. I was like, okay, great.
Praise God.
Discharge me. I'm fine. I'm cool. He said, are you sure? I said, discharge me. If my baby's going, I'm
Mm.
going too. So I couldn't be in the same ambulance, but I followed soon after and then soon got there. So fast forward now, in terms of my baby, he is healthy. The support network that I've had in terms of GP referrals has been absolutely amazing. If I was want to have an additional checkup because he was preterm, they would allow him to be admitted to just check him out and so forth. But I trust the situation. Be patient. It's not going to go according to the normal milestones. So in terms of the
Mm-hmm.
walking, the eating, it's going to take
Mm-hmm.
slightly longer for certain milestones to come about.
Mm-hmm.
And so I've been very patient throughout this whole journey. And from 3 years old onwards, he's been discharged from the care of the checkup system. So it's ever so often they'll check up with him, and he's been charged from that exercise. So thank God, obviously, he had no complications. But in terms of when to get him home, it took about a month,
Mm-hmm.
and they wait for a certain baby weight to do so.
Mm-hmm. Mm-hmm.
My only sort of looking back is I wish I didn't get him home quicker, if that makes sense. Because once he's home, that's you. That I mean, I mean, you wouldn't want to readmit your child, but it's like you're just yourself and your husband is taking care of this. I mean, very small baby. I think is it Perilon? You said that your child was. Oh, you're me, but you said but yeah, the weight that you just said, I can't.
He
Like
was
my heart.
15 ounces, 15 under a pound, and he was born at 21 and 6, 21 weeks, 6 days.
So mine was 3.3 when he was born, and I had to wait for I don't know what it is 1.8 kg. I can't remember what that is in pounds, but that's what I had to wait for. And even to get him circumcised, I had to wait until he was a particular weight in order to do that. But even in feeding, I had to wait for a particular like this technique. He would choke. They teach you CPR before you leave the hospital in case you have to do that at home. I had to do that once at home. Like he was choking on the milk because his airways, like our milk doesn't come from our body or the formula is too thick at times. So that was what was frightening in terms of rushing him back home. It's like I should have taken time, maybe add a bit more weight than the scheduled weight that he can be discharged from. So let me just pause there just in case anybody wants to probably contribute or ask any questions on that. Sorry, like I said, I could speak a whole hour about this.
No, you're perfectly fine. I wanted to introduce everyone and give them a chance to share a bit of their story. So we'll pause there and then we'll revisit that. Um, Thank you for sharing your story. I don't think I've ever heard it in detail. I know we talk about anything and everything, but this is a subject I feel like we haven't really dove too deep in. And I think for me personally, I know having a baby and having a baby that you're not able to hold, at least whether they've gone on to heaven or they've been in the NICU, is a very, very personal and tough situation and conversation that you don't often want to have with friends. So thank you for sharing that story. So I want to go ahead and give an introduction and a brief overview of our next speaker that's going to join us in this discussion. And so hopefully you are seeing, oh, hold on. I'm going too fast for my own good. Hopefully you are seeing her wonderful picture, and that's Miss Perry Lynn Bell. She is a wife of 13 years. She's been with her husband 23, recently became a mother to the most amazing 21 weeker, as she mentioned earlier, SJ. She's a teacher, a coach, a Hall of Fame athlete with several school records, and she's the owner of Begin Now Athleisure Wear, which is how I connected with her. So if you're stateside, definitely do look at her outfits up. Bomb. But she is an operator at Dow Chemical for 10 years, a mentor and a child of the Most High. She delivered her baby at 21 weeks, and 8 months later, he came home from the NICU. So imagine 8 months not being able to hear your baby cry in your house or wake up in the middle of the night and make a bottle. I know that must have been tough. That waking up in the middle of the night is rough, but not being able to do it, I think might be even rougher, especially when your body is trained to do that naturally. So he recently made 2 months since he's been home. Her business, Begin Now, is a luxury athleisure apparel brand that believes in beauty comes in many different forms. Her mission is to help you look and feel your best regardless of color, size, or shape. She promotes positive and healthy mindset, and she believes it's not too late to begin now. So we welcome Miss Perry Lynn, and please do give her some virtual hand claps, hearts, all the good stuff as she shares her story.
Well, thank you. And thank you so much for having me. If I'm a little dark, let me know because I have the light off. I had a glare. Can y'all see me pretty good?
Mm-hmm.
Okay. Okay. So, as she said earlier, I had my baby. My husband and I have been together 23 years, never been pregnant as that I'm aware of. And when I got pregnant, I tried finding an African American doctor, which it was a little hard being here. I didn't find anyone, but I found an Asian lady, which by the grace of God, I went to it's a hospital called Kelsey Seafold here. That's where I actually went for my checkups, but they deliver at the Women's Hospital of Texas. And like, is it Fia? I'm sorry, but like she said
Faye,
earlier, oh, okay. So like you said earlier, there's different levels of hospitals that you need to go to whenever you're having a premature baby, so that you can ensure that they will intervene. But with me, um, the doctor, I'm pretty healthy. I work out, I try to eat healthy, I'm pretty active. So I would work out. The doctor said it was okay. Everything was clear. My baby always had a heartbeat. He was always healthy. All of our tests checked out perfect. Never had any issues. But the doctor told me I can continue my normal routine that's having intercourse with my husband, working out, doing everything that I normally do. So I took her advice and I did. Well, I started having I started passing blood. So I took pictures, took videos. I let the doctor know. She said, "Oh, it's fine. You know, that's normal. It's completely normal. You'll bleed probably up until a certain amount of weeks and it should go away." Well, one day I passed a blood clot. So I took a picture, took a video, contacted my doctor, and she had me go do tests. They did an ultrasound. They checked for like kidney disease. They checked for liver disease. They checked all my organs. Everything was fine. But she said that my liver may have been there may have been an issue with my liver. Come back, nothing happened. So she diagnosed me with subchronic hematola, and that's basically like a hemorrhage base, and it goes away. I In pregnant women, you have it. Some women have it, some don't, but it goes away after a certain time. Well, I wasn't satisfied with that, so
mm,
I told her I wanted to see a specialist, and it's hard trying to get a specialist. So at this time, this was around November. I saw a specialist on December 30th. So it took almost a month before I was able to see anyone. So whenever I went to see the specialist, he done an ultrasound, and he did a vaginal ultrasound. My doctor did an ultrasound, but she used a speculum, which is basically if you've ever had a child, they check you with a speculum all the time. And she told me my cervix was closed based on her checking me with the speculum. However, when I had the ultrasound with the doctor, he told me that I was 3 centimeters dilated. At this time, I was in 18 weeks. So I went to the hospital, the woman's hospital, to get a cerclage put in. So if you don't know what a cerclage is, it's basically a stitch to hold your cervix in place. And usually women get a cerclage to prevent the baby from coming out. But at 19 weeks, it's a little late. You usually want to do it 12 weeks. But in my situation, that was the choice that I had. I had to get a cerclage put in. They put the cerclage in, but they told me that the risk would be PPROM, which is premature rupture. Thank you. Premature, premature rupture of the membrane. And so, sure enough, I'm like, well, I should be fine. But anytime you're pregnant and they're doing anything down there, you have it's a high risk of getting your membranes broken or even an infection. So on the 30th, I got the cerclage put in. I went home on the 31st. I was laying in bed and I felt something leaking. And this was like 2 days later after having the cerclage put in. So I called my husband. I said, I think my water broke. Never been pregnant before, but I had sense enough to know that something wasn't right. Sure enough, so I put a pad on and I monitored. I said, well, I'll see how fast it's leaking, if it's still coming out, what's going on. And I put a pad on and it was soaking up the pad. Took it off, put another one on. And sorry, I'm being very graphic, but I put another one on, it soaked it up again. So that's when we went to the hospital. I was admitted in the hospital. Sorry, let me back up. After the cerclage, I was released to come home on bed rest. So I was admitted back into the hospital. And when I went into the hospital, I was going to stay there until I delivered.
Mm.
So this is 19 weeks. I have to stay until I deliver my baby the entire
Mm.
time.
Oh.
So I said, okay, well, and I'm a private person, but a public, I'm like a social introvert. So a lot of stuff I don't share. And so I was like, well, I'll be here in the hospital until I have my baby because I want my baby to be fine. So I was fine. I said, I'll just sit here, lay here, do whatever I need to do. I'm stiff as a board. Don't want to move, scared that I'm going to leak my water out. I was getting ultrasounds every other day just to see how much fluid I had. And like she said earlier, my baby plugged himself. So he plugged himself where I wasn't leaking fluid. But this particular night, I was 21 weeks. I had already been in the hospital for about 2 weeks. So I was 21 weeks and 5 days, and I felt contractions. I said, well,
Mm.
I don't know what's going on, but I kept feeling contractions, and they put the band on me. They measured, they monitored. They said, oh, no, you're not having contractions again. He's just aggressively moving. And I was like, no, I feel contractions. So I had them monitor me. Well, I have the cerclage in. He's small,
Mhm.
he's tiny. So I'm afraid that he's probably going to come out if I don't
Mhm.
get the cerclage put out. So I had them call the doctor and ask the doctor if she can do an ultrasound to see if he was head down or if he was breached. My entire
Mhm.
pregnancy, he had been breached. So he was head down. And because he was head down, I said, well, what will happen? I'm 21 and 5. The viability age at the woman's hospital is 22 weeks. And that's when they'll intervene. So viability is basically when the baby is able to survive or when they'll intervene. Most other places are 24 weeks. So I told them I want my baby. But while I was in the hospital, I had doctors come by. One doctor told me she didn't think that I should deliver. I didn't look like the person that could be a parent to a premature baby. It wasn't, the support wasn't there with certain doctors. And so I took it for what it was and was okay. Well, we removed the cerclage out. And once the cerclage was removed, they did have a team. They put the a baby, like everything in there for the baby in the room with
Mhm.
me, but he never came. So by this time, I'm 21 and 6, which is another day to get to 22 weeks. But the next morning, the doctor came in and she said, I have to take your baby. I said, why? What's going on? She said, your body is setting up septic shock. So she said, I'm at risk of me or the baby not making it. And I said, okay, well, can you get the team that's going to get my baby? So she left out to go get the team. And at that time, when she left out to go get the team, I just felt a gush. Everything broke. My entire water broke. So I had my husband push the button and call them back. And she said, you're 100% dilated. We can have the baby. And he was head down. I didn't have to have a C-section. And we pushed and he was there. Well, he came out and he wiggled, but he wasn't breathing. And so the team was there. They were trying to put the tube down to intubate him.
And a ticket, please. Thank you.
You can continue.
Okay. They were trying to put the tube in to intubate him,
Mhm.
and they couldn't get the tube in. He was so small. He was 15 ounces. So 15.7 ounces. He was 21 and 6. I'm not sure if I said that, but I had him at 21 and 6, 15 ounces. So he was under a pound, and trying to get the tube in to intubate him was the struggle. So it took them a while, but once they got the tube in, they said, well, we're going to have to take him to the NICU. I didn't know what any of this was. I've heard of people having premature babies, but I was uneducated about it. So he went to the NICU. I had to go to the room, didn't get to see him or anything. They took a picture before he left. Didn't get to see my baby, didn't get to hold my baby, didn't know what was going on with my baby. And that night is the first time I was able to go. They brought a pumping pad to me and a pump and pads and said, you know, you need to start pumping. He needs colostrum. I knew nothing. All I knew is that I didn't have my babies and he's in the NICU. I didn't know if he was breathing, if he was going to make it or what was going on. So that's my story. Any questions?
Jesus. Jesus. That is strength right there. To be able to lay in a bed and fear that, you know, if you sneeze wrong or if you turn over too fast trying to get comfortable, something can go wrong is terrifying. And I shared with the ladies earlier, I had a baby 5 months ago, but it's a very scary thing. And she's my third child, and I was terrified like none other with her delivery just because of the pregnancy that I had with her. So I can imagine being completely still, but still feel that terror of, you know, if I try to turn on the TV, will that do something, you know? Whew, that's terrifying. So thank you for sharing your story, and we'll continue to share in this conversation and bring up our next panelist, who I'm very excited. I think this might be your first time sharing with us, if I'm not mistaken. One of our newest honorary initiates, Sora Jeannie Joseph. She is a British trained midwife who fights to ensure every person has their healthiest possible pregnancy, birth, and postpartum experience with dignity and support. She created the JJ Way, which is an evidence-based maternity care model delivering readily accessible, patient-centered, culturally congruent care to women in areas that she terms maternal toxic zones. So if I say these words wrong, please let me know. Her focus and drive is to ensure that Black women and other marginalized people remain safe and empowered inside broken and inequitable maternity health systems that are dangerous and all too often lethal. She is the founder and president of her own nonprofit corporation, Common Sense Childbirth, Inc., whose mission is the elimination of racial disparities in maternal child health in the USA. Common Sense Childbirth operates a national training institute, health clinics, and a birthing center in Orlando, Florida, and the National Perinatal Task Force, the grassroots organizing and movement building arm of her nonprofit. She is also the owner of the first and only Black-owned nationally accredited private midwifery school in the United States. She is the founder and a proud member of the Council of Midwifery Elders, is a fellow of the Aspen Institute, and she serves on the advisory council for the Congressional Black Maternal Health Caucus. She was commended by the Georgia Assembly in 2023 with an honorary House Resolution, HR 561, after being recognized as a Time Woman of the Year in 2022 for her work in promoting prenatal equity, a proud honorary member of Zeta Phi Beta Sorority Incorporated. She has most recently re-released her book, Beautiful Images of Health, Joy, and Vitality in Pregnancy and Birth. She has launched a new podcast, and I encourage you all to tune in, the Perinatal Pause, because she is determined that more Americans understand the word perinatal and why it impacts all of us so deeply. And as Jeannie often says, it literally is a matter of life and death. So let's give some virtual hearts and hand claps as we round out this discussion, and I will allow you to share a bit of your story. And thank you so much for saying yes to this conversation. Because like I said, it's very important. And like you say, it is a matter of life and death.
Yes, it is. And thank you, Mani and Romanda and Soros, for the invitation. What an opportunity to be in community and fellowship with everyone. And also, again, to be blessed with folk who have had these experiences and who are willing, are open to sharing, are vulnerable, and to create a space for us all to have these really hard conversations. We need to share about these stories because so many people don't know. What really always happens when we talk this way, when we are authentically able to, tell what's happened, the same themes are showing up. There's so much trauma. There's so much shame and blame. There's this lack of power, this lack of understanding, the helplessness that comes with this. We're talking about physiological things, babies that don't go all the way to term. A full-term pregnancy is 40 weeks. And babies that don't go all the way to at least 37 are considered to be preterm, meaning born before they're fully, completely developed. And yet the two stories we've heard, Sora and Perilyn, you've got that proof. And Faye, your husband as well, that people do survive prematurity and they are sound and whole. But what gets them there is that constant support, that love, that nurture. And it's not just breast milk or, food, it's these other wraparound things. And we don't incorporate that into our care. We don't incorporate that into the medical or the midwifery transfer of care. So when that happens, people actually thrive, whether it's the pregnant mama or whether it's the baby. And the family too, because this affects the whole family. This affects the whole close community and the wider community. Every last one of us is impacted by prematurity. So my story is that I was born and raised in England, and I feel very emotional as I'm listening, especially to you, Faye, because I know London, I know those hospitals. I trained in Edgware, which was back in the day, 1970s. You guys were never even probably born at that point, but nonetheless, I have a long history with England and the National Health Service and with midwifery. And I've been a midwife for 42 years. But I moved to the States in 1989 and had no clue what I was going to. And when I arrived and learned what was happening, realized that the large numbers of babies that are being born premature in the United States are Black and brown babies. The majority. There's a myth, there's a trope that says that Black women and people of color can't carry babies to term. And that is perpetuated by a system that America has been built on this way of being around Black people. Racism, classism, sexism, these are the dynamics that impact how care is delivered, right? And that's why when things go south in your birth experience, it's based on other things than just physiology. Inside of every story that I've ever heard around prematurity, there's an element that mother was not listened to. That mother was not heard. We're lucky today to hear these stories, these miraculous stories of women who fought for themselves, for their babies, had support and had agency and power in fighting. But in absence of that, we don't prevail. Our babies don't survive. Our mothers don't survive because of that one thing, not listening. In the lack of listening, in the lack of respectful care, in the lack of dignity being part of the care package, we suffer. And this is historical. Sadly, this is structural. This is not something that we have caused or we're responsible for. We have systems of care that are built on these historical and structural and institutional ways of being. There are certain hospitals that have more capacity to do better service, but we don't always get access. We don't have enough knowledge or power, right? There are certain medical procedures, again, that get meted out according to who the providers consider you to be, how they judge you, how they determine what are the parameters they're using in this instance. Shall I or shan't I refer my client to a higher level provider? Shall I or shan't I listen when this person tells me they know what's going on with their body? Shall I or shan't I, accept that type of insurance or recommend these kinds of services based on what I think I know about this person or their situation? These are the reasons for prematurity. And I say that because once I got to the United States, once I figured out that I didn't actually fit or belong in this system that was there was nobody interested in hiring a midwife, working with a midwife. They laughed in my face. What are you talking about midwifery? But what I was able to do was establish my midwifery practice by doing home birth initially, and then doing birthing center births, which is freestanding births outside of the hospital. But what I also discovered on that journey for my own liberation to be able to practice the trade and the profession that I've loved my entire adult life, what I discovered along the way was that when you provide service with support, with love, with care, with listening, with dignity, with respect, mothers go to term. It was that simple. So where we think that you need certain interventions, such as a cerclage, like Perilyn said, or such as, medications or bed rest, we don't need any of those things all of a sudden. And working with people of color who had historically been told and were expecting that all that they could, hope for was maybe I'll make it to my third trimester, or maybe if I have an early baby, it will make it, and maybe all of a sudden, we found that providing midwifery care with love and with respect was enough to hold that cervix, and everybody was having these big old chunky babies at term. Many of them went past their due dates for the first time and were telling me, well, can you get this baby out of me? I'm so tired of being pregnant. I'm like, no, we're going to wait for labor to start naturally, right? But our average babies are 7.5 pounds, 8 pounds. Our average gestation is 39 weeks, 40 weeks, 41 weeks. These mothers who have formerly been told, no, I mean, I've had so many folks that I've worked with who've always had premature babies until they've come through our service. And they're like, well, what are you doing? What's the difference? Nothing. We're not doing anything. We're just providing comprehensive wraparound support, non-judgmental care. Care that says you are here, you belong, we will take care of you because of your humanity. That is the card that gets you in the door, not whether you have the right insurance or if you have enough money or if you have your papers in order or any of the above. Just from the place of understanding the physiology of birth needs support, needs care, needs love. And with that, anything is possible. And so I really, first of all, again, want to just thank you, Perilyn and Faye, for sharing so deep and authentically, but to realize that every one of us, whether we've experienced prematurity or not, feel it. We feel it in our bodies. We feel it in our uterus. We feel it in our heart. Because what we're talking about when it comes to bringing life is that this is more than just this process of, putting a physiological thing together and it happens. It's deeper. And this is why our generational pain, our generational suffering also carries on through, and why we must support each other, why we must learn and understand these systems so that we can be there for our sisters, our family, our community in the way that makes a difference. Finding support is key. You cannot do this alone. You cannot do this in a vacuum. And so many of the families that we service, at least in our area, they are unsupported. So I'm so thrilled to be part of Zeta Phi Beta sorority. I am so thrilled because this network is strong, this network is deep, and clearly we're all about support. So yes. I'll stop talking because I'm happy to take questions. But I just thank you that you've invited me. I know we are marking World Prematurity Day, which was November 17th, and November is Prematurity Awareness Month, at least in the United States. But it's deeper than prematurity. It's across the board. And I think this is the opportunity for us all to grow and to share and to support all of us, every last one of us, because every person matters. And it is about life and death.
Thank you. So I'll pause here. And if there's any questions, Ro, that you see in the chat, or if anyone has any questions, feel free to type it in the chat and Sora Dylan will go ahead and read them. I do see a hand up. Is it Tanita?
Greetings, Source.
Greetings, Tori.
I
How are
am
you?
here in chiming in from Los Angeles, California. Hey, Jenny. I wanted to as you chiming in on all parts as the international vice director of honorary membership. It is an honor to be here this rising, and to see Jenny on, especially with the England chapter. Where's her home base? I wanted to just send a heartfelt, heartfelt love out to all those who shared their stories this rising. Well, rising here. It's it's early here. I wanted to just just send out that love and take a moment to just honor you. Yeah, for sharing in this space. And also I'm chiming in as a mom who can concur with what Jenny is saying. Jenny delivered two of my babies. I had the honor of having her as my midwife, and she is correct. The level of care that I had with my first son when I was in the hospital, versus having a home birth with her, and then also having a birth at the birthing center, were like totally different worlds. It was like I was in totally two different worlds. Um, I can tell you, and I can testify to, being around and forming community and understanding that having a baby is not just on the mother, it's not just on the father, it's on the community at large. What I also learned from being able to doula with Jenny is that I was able to just serve from an intuitive space, knowing that I am a mother, I was a mother, and then helping other mothers, helping other sisters, other swords when they had their babies, just going with my intuition and saying, you know what, she needs food, she needs extra blankets, she needs her stomach tied, she needs me to hug her, she needs me to grab the baby for a moment, she needs me to put water by her, just the small things. We don't have to be doctors, midwives, lawyers, doulas, these have all these titles in order to just tap into our intuition and say, our sister needs us. And something just changed. She just had transformation in her life. And support is what she needs. Community is what she needs. What they need, what the baby, the mom, the dad, the family needs. So I just wanted to chime in from that and say thank you for holding this space.
Thank you for joining us, Sora, and it's always a pleasure to see faces with names that we often see in emails in our in our world. So I'm so excited to see faces with names and hear voices behind it as well. It definitely it warms my heart a little bit because you are oftentimes in a bubble in London, but it's nice to see and refreshing. So if we don't have any questions in the chat, Sora Dylan, did you see anything?
I don't see anything, but I have
Okay.
a comment that's gonna lead to a question also.
Okay.
Hearing y'all stories, just y'all, and Money can tell you, I am team no kids. I am team firmly no kids, but that's for plethora of reasons. I actually love kids. I love to give them back even more. But I do love kids. But one of the reasons is a fear, a deep-seated, rooted fear of not being heard, listened to, if something goes wrong. Like that is, I have anxiety, like even thinking about it sets off all my triggers. I just turned 41, and as I hit 40, I went to this phase where, like, okay, Ramanda, if you truly know kids, if that's what you want, Is it truly what you wanted? Me and my husband actually went through months of like, I give him total props for not freaking out. Cause I was like, we reached a point where I was like, maybe I do want kids. And if I gotta want kids, I'm almost 40. We gotta make that decision. And I give him props for just going through those conversations with me and making sure like, yes, that's still what we want. And we went through the whole talk, like, if you want kids, is it now, or what that looks like? And he knew my fear of actually giving birth. He knew my fear of not being heard, and he was like, so maybe that looks like adoption for us if we decide that and all of that. So it is a part of me that wonders why, if some of our community, we see the stats, we see the stories, we see, everything that's happening and we realize like we don't want to be put in that position of not being heard. We don't want to be put in that position of potentially losing our baby life and our life and all of that life, and that not come for, not come that's coming into play. So that's just a little bit my story in terms of the Teen No Kids. There's other reasons why. I tend to like my lifestyle. I travel a lot. We travel a lot and everything, and we like naps. So there's other reasons into play, but that is a big factor in me going the no kids route. But my question is, this webinar was also geared towards education in terms of just terminology and what everybody does. And like midwives, I didn't know that term until I moved to the UK. And I know we don't have any on the call, but if you have experience with them, could you at least give like some feedback or thoughts to like midwives, doulas, which is becoming more and more popular, trending, or however you want to say it, within the word in the world of birthing processes, especially for Black women and families. Is that potentially to give some education on those two different terms and what they do differently or not?
I think Sora Joseph might be able to answer this best.
Yes, thank you. I'm happy to answer. I know Faye has her hand up. Did you want to go first, Faye? Or?
My one was in relation to a question rather than the answer, so I won't be any help.
Okay. Let me just quickly say, midwifery is normal. Midwifery is what has happened for millennia. Women have always attended other women in birth. And so the midwife is a professional terminology that's given to people who are trained in normal care for healthy pregnancies, deliveries, normal labor and delivery, normal postpartum, and in between of the pregnancies as well. So midwives can provide women's health care, such as regular GYN exams, pap smears, breast exams, pelvic exams, and so on. The midwife across the entire rest of the world, except for the United States, is a normal provider once you are in the maternity cycle. Through the childbearing years, the midwife is the first provider for that care. A doula, on the other hand, is a professional who's also trained, but is working from a perspective of support, educational support, emotional support, sometimes often spiritual support, family support, and being there as an advocate for the birthing family so that they can have their needs met. And they actually help sort of almost run interference where you aren't being heard, where you might be struggling with getting your points across or having your wishes, agreed on. So the doula stands alongside. In old days, we used to call these coaches. Lamar's class, when you would do childbirth education, and the coach usually was your partner, your husband, but doulas are typically female. And they are not midwives because they don't do any medical care whatsoever. They don't take your blood pressure or check your urine, but they will stand with you, support you, carry you through the pregnancy and the postpartum, as well as the labor and delivery, helping you with techniques, breathing techniques, you know, exercises and so on. So those are the differences between the two professionals. But also it's important, I think, just throw in here, the systems are also different. So in America, for example, the system of maternity care is that only a physician apparently knows how to deliver a baby, knows how to do your prenatal care, and knows how to take care of that. In actuality, physicians are there for complications and only complications. But in the United States, they do all care. And that's where the monopoly shows up. That's where money's changing hands. And that's why midwives were eradicated. Midwives delivered America, especially Black midwives, through enslavement, through post-slavery, during Jim Crow era. Midwives were eradicated in the mid-20th century. Black midwives, Indigenous midwives were sort of put aside so that the hospital system and the physicians could take over birthing because money was again changing hands with Medicaid. So we have a historical issue in the United States in relationship to midwives, and midwives aren't common even to this day. And then the rest of the world, Europe and other countries, they all use midwifery as the primary healthcare provider. So hopefully that helps clarify.
No, thank you. Like I said, I didn't come across the term midwife until I moved to England. And then I was like, what is this? But no, thank you for that breakdown. If anybody has any questions, please raise your hands, or Money, you can go down your question list.
I know Faye had a question. Go ahead, Faye.
Yeah, I think my list is increasing in terms of questions, more answers. But number one was in UK, please correct me if I'm wrong in terms of law, but if a woman gives birth before 24 weeks, the doctor is not ought to step in because of the viability. And it was just fascinating to obviously hear Perilyn, not Perilyn, so apologies for getting your name wrong, that yeah, the doctors stepped in. And is it because it was 20 to 22, or is there a particular sort of cutoff point where they don't intervene whatsoever, regardless of what you say?
Okay, so for me, the hospital that I was at will intervene at 22. It's one of the only ones in this area that will intervene at 22. And that just changed. Last year, it wouldn't have happened. Had this happened last year, my baby wouldn't be here. So now they said that, okay, babies are able to be viable at 22, where they will intervene. And I'll be honest, they did not want to. They didn't. They were scared. The night doctor, which is when I started having contractions, said that he would do it, but his team wasn't willing to. So I experienced that. And that's another reason why I did not want the cerclage taken out. So the next morning, the doctor that came in said that she had to take the baby. She didn't say she was going to do anything with him. She just said she had to take him. So at that point, I fought every medication. I fought staying awake. And at that point, I said, well, will you get the team? I wasn't going to push. I wasn't going to lift a leg, a finger, a toe, anything until they were there with all the equipment to take my baby and make sure that they were going to at least try every effort to save him. So not every hospital will do anything. Most of the time they'll do something, if you don't know, it's called comfort care. And that's when they give you your baby and you're just able to hold the baby until the baby passes. And I know she has questions later that we'll get into, but for the most part, I mean, it was God. That's all I can say. Everything happened in God's timing, and it was definitely God.
And your power, because you had the agency to fight in that way. You had the, that same God-given knowledge and power to stand for this to happen, right? The two things are together. It's not because each different doctor had a different version of what they were going to do. And the doctors, especially the United States doctors, are working from a place of litigation. It's always going to come down to legally, are they going to get sued or not? This is where they take their stance based on how safe are they in making a call, making a decision. right? And when the hospital arbitrarily puts a set of parameters like 22 weeks, for example, that hospital risk management made that decision, not the physicians, risk management. And that's a real difficult one to go against. So someone like you, Perilyn, where you stood hard, you thought it through, you spoke up, you fought for your baby, and you won. And it's the folk who don't have that agency and power or knowledge, they can't win against a system like that.
And I will say this. Sorry. I'm sorry. You can go
No,
ahead.
I was just going to say, in England, when I left England to go to the States in 1989, we were still at 28 weeks pay for the cutoff. 28. You went to the GYN floor. You didn't go to labor and delivery in 1989. You were still going to wait and have the baby in a bedpan, and they put it aside until baby stopped breathing. That's what was going on all those years ago. So to get to 24, that's a big change. That's a whole 4 weeks that didn't used to be in place for prematurity, for caring for a baby.
And I'll say this, the only reason they did it at that hospital is because it's a private hospital. So public hospitals will not do it. So I was fortunate enough to be at a private hospital that would intervene.
Thank you.
Faye, I know you said you have a list of questions.
Just a second one. It's a second one. Just,
Go ahead.
the doula, because obviously I think I hear it probably mostly in films than anywhere else in terms of my community. How accepted, again, I don't know, Jenny, if you keep in touch with the UK on this, how accepted is it for someone to be in a room and all the appointments and so forth when there's limitations?
You mean like because of the COVID limitations that they kept you apart from your husband, or?
I guess I understand from the COVID perspective, but I mean, post-COVID now, I don't know whether anyone else. Oh, we're doing, okay.
Thing is, what happened over the years, is, especially as doulas have become more popular and people have become more educated about their rights and their opportunities to have their birth plan respected, there's been a swing towards patient having more autonomy. I'm going to use that word. That's really what was going on. COVID was so handy because, we can now flip back to how we like it. And, you know, from a professional point of view, there's some efficacy in having, oh, well, you go home at this time, give us some space. We want to do this. We want to do that. We want to hand over a report. All the things that we've created inside of the system. Remember earlier I was saying it's a systemic problem. It shows up in the impact on how our care is delivered, but it also gives the institution more power to have their way. And it's not that they're malicious or mean or bad. It's just that what's efficient for getting this volume of care done that they have to do. So since COVID, we've seen, at least in the States as well, we've seen less likelihood that you can get, you know, that one-on-one care or more than one person, or how many support people you'd need in your exam room or in your delivery. And they've sort of leaning back towards, well, you know, the policy. So there has been a shift after COVID. COVID had a very valid reason, but now there's none. It's just a matter of, the pendulum has swung back and we have gained back some ground. The institution, have gained back some ground of telling us what we can and can't do, right? And that also takes our power because you're helpless. What are you going to do about it? They have you there and you're there on purpose, and yet at the same time, you cannot get what you need. And we know, again, proof is if you have support, if you have somebody there, you will do better. So yeah, it is a shame, but this is what's happening, and it's worldwide.
You actually led way to the question I was going to ask first. So how can your birth team support you during delivery and premature birth? And I know you can't really prepare for a premature birth. So Perilyn, like, how has your husband supported you? Did he take classes? Did he educate himself? Same to you, Faye. I mean, even though Chuma was a preemie himself, did he, you know, try to read up on some new information? Because I know my husband, he probably would have read every book, interviewed every doctor if he could have, if he were to find out that we're having a premature baby. So what are some things that your birth team can do, Sora Joseph? And then what are some things maybe you've done or your partners have done, Faye and Perilyn? And we can start with Perilyn if you like.
Okay, so for me, once we started having the difficulty with the bleeding and seeing different doctors, My husband was there every day. He went to every doctor appointment. He took off if he had to work. There wasn't anywhere they saw me without him, which was very vital because just seeing a young African American couple, professional couple, not just anyone off the street, because I see a lot of times that's really the stigma whenever they feel like they can tell you you don't belong here, don't can't afford something. That's when you really get the treatment however they want to treat you. But in this case, we showed up as a family. We showed up as a
Mhm.
couple, we showed up as a family, but most importantly, we showed up professionally. So we didn't go to hospital visits looking any kind of way or speaking any kind of way. We always made sure we were educated about what was going on, and we actually would go and have questions for them when we would go. And after we had the baby, or while I was on bed rest, when the doctors came, he did go to work during the day, but he stayed there every night. So every time someone would come in the room, they didn't just see me, they saw him as well. And if he wasn't there, I would FaceTime him so that he can hear what they were saying, so that he can ask whatever questions he had. And then both of us started studying. I mean, TikTok was a great resource because there were people who experienced what we were going through. And so I would look at TikTok. But besides my husband, I had a community of 6 of my sisters that every day they called, they checked on me, they were asking questions for the doctor. If need be, they would take flight to come here because not all of them lived in where I live. So they would come take flight. So besides my husband, they knew that I had other family and friends who actually
Mhm.
cared. So
Mhm.
they always saw someone present. They didn't just see me. And that made a huge difference for the treatment and the care that I had and my baby.
Thank you. That's good. That's good. So you built yourself a community around you that was visible to the medical staff.
And if they
Um,
didn't see him, they heard him on the phone. And it wasn't, I mean, there was powerful women like from different, some were mothers and some weren't, but they were there. Attorneys, engineers, professors, I mean, you name it, nurses. So they were seeing different educated Black women, and then also my husband. And so they knew that we were a family that was going to do everything we could for our baby, but also a family that had family once we left the NICU. And
yes.
so that was
Yes.
important. And I think it also made them know that we're going to do whatever we can to get this baby home. And once he gets home, he's going to thrive because he has a supported home. And that's made
Mhm.
a huge difference also.
Okay. Okay. Faye, what does support look like for you all?
Support. Okay, so in UK we had share parental leave, whereby I can share my 12 months with my husband. So if I even wanted to do 10 months and he does two, yeah, that's what we had done, which helped us massively at the beginning. Thank God that we actually put that in place, given the circumstances, and we don't know obviously that we're going to have a early delivery. And so that helped with him being home. I believe it was initially 2 months, and at the end, he's the one that weaned him into a nursery. But that helped for him to be around for those solid 2 months. And being the go between myself and family, because I closed myself off. I didn't want to. There was a time when they had lifted COVID around when he was born, so I could have had family over. But for me, where I was in that time, I didn't want to see anyone because all you're coming to do is look at me. And I saw it as you're taking up my time that I could have spent being with my son, if that makes sense. Unfair to say, but that was the truth. I literally didn't want to say anything. And what you kind of congratulate me because I haven't got my baby in my arms. So being that go between myself and my family, and having that broadcast list of saying, preempting almost what people are going to ask. I didn't want to have any questions. Is he home? Is he home yet? Is it? I don't know
Mhm.
when he's going to be home. So I literally, had some information for my husband to circulate to the family in terms of his birth weight, what criteria he has to meet before he's discharged, that
Wow.
he's healthy, doing well. All of that information, it helped to just send it before they even asked, because I just couldn't bear to
Mhm.
see it and hear it. I didn't check any media platforms. There are support websites and pamphlets that they hand to you, but I kept off that. again, my own personal sort of preference, and it was just prayer. And the way that my persona with the staff at the hospital, be polite as possible, because listen, they're going to be all round the clock taking care of your child. So pleasantries, even though it's their duty of care, but a smile goes a long way. And greeting someone in the right way, again, like Pelham was saying, being professional and so forth, but also being personable. And when it came to the doctors with their bed manners, um, um, yes, I just regurgitated in terms of the terminologies that they were using back to them, to almost say, like, I'm an educated person, I understand what you're saying, and I'm not just an NHS number. And as soon as you start saying similar words to what they're saying, they treat you differently, surprisingly. And so that helps to obviously keep in touch, in terms of his development, in terms of my child and so forth. And as soon as he got home, that respecting of that little bit of space, because I didn't have that initial, he's back home and having that sort of immediate family unit together embracing him. I just said, please bear with me as he builds up his immune system. Again, communication piece with the family for 2-3 weeks, which is the longest 2-3 weeks for other people, obviously. But I'm just saying, just bear in mind he's preterm. I'm not trying to get that into my head. That means as if he's any less than any other child, but it's just that sensibility of like, okay, he's building up his immune system. He's been in the hospital. Let him get used to our immune system, or our bacteria rather, in the house, and then we can welcome family. And they're being so respectable in terms of waiting, being patient. How can I support and help you, and so forth. So communication is key, is what I would say. And I'm a faithful, I don't know, sorry if this is a society of Christian ladies, but in terms of a woman of faith, and that's why it's my most vulnerable moment I've ever had in my life. So drawn onto him was paramount.
And one thing I heard, you created sort of a news flyer for the family, because those text messages will fly in. Even if your baby is not premature, those, can we come see? When can we see? What do you need? Those messages fly in. And I should have probably thought of having a news flyer when I delivered my daughter. My husband is the only boy, and this was the first girl in like 30 years with a family of 6 sisters. So the door was always open for someone with something, and usually was a new outfit. So I'm like, y'all, I want food. It's like, all right, clothes are good, but I want food. So, Sora Joseph, how have you educated women to kind of build their support system around them when they go into delivery or have had premature babies?
Yeah, this is, I mean, just what a rich conversation. So much good information here from both Caroline and Faye. That literal support is the key. And, in this case, both of you have described how you were sort of almost the leaders of that support. You figured it out too, and you worked it, right? And it happened that it was doable and achievable for you. I feel like, and this is what we do with our clients, we're building that same power from the day one, from the first visit, no matter how many weeks pregnant they are when they first get to us, to model for them how, if it's a couple, if it's the neighbor, whoever's with you, that person's on the team. We're building a team from inception, and that team will carry you all the way through the delivery and out the other end. Now, luckily, we haven't had to deal with prematurity. Seriously, I mean, I'm not making this up. We had one premature baby in the COVID year, and there were an increase in premature babies during COVID overall. But out of 480 patients that went through our clinic, we had one. And we've always had a low number of premature babies. That baby was a 34-week, big old chunky thing, came out. She was home within the week. Nothing wrong with her, right? But the way we work anyway is that we start the support piece as part of the prenatal care. So your first visit at any provider, you're going to get your blood pressure and your urine check, and they'll take some blood work and poke your belly and blah, blah, blah. We do all of those medical things as midwives, and then we add on, and this is how we're going to do the support. First and foremost is a 24-hour number. They get a number directly to the providers so that they can call us with any little thing. If you have a hangnail, get on the phone, because we don't want to miss anything. So that is imparted right away. So we do that in the medical sense because they're coming into our clinic, but they then take it out into their family and say, okay, there's a 24-hour number. Everybody needs to know it. Get it in your cell phone, write it down, right? Because the midwives want to hear from us if there's a problem. So they can start eliciting their own team in their own environment with whoever's in their support. And many of them don't have support at all. Nobody. Right. So we dig in and we figure out what's the structure, what's the framework that we have to put around you to support you and this child to full term and postpartum to keep you going. Because postpartum is a miserable place if you don't have support. That depression will lock in and it's not going anywhere. It's not baby blues, it's depression. It's anxiety.
Yes.
Right? It's not, postpartum is forever. I mean, we have a 6-week time frame in our mind. It's not true. So we know that not only do we want to model what support looks like and the practical ways to get it done, but we also want to engage team members, whomever are on the team. So this work is why I was saying earlier, you know, as a sorority, we have an opportunity to build that support into just how we are in general. Any pregnant soror or their family member can be supported with just having that little conversation. Who's on your team? Have people begin to think about that. What does that mean? Well, you don't, again, like Tanita says, you don't have to be a professional to be on the team. Who's going to be the one who's giving you that ride to the office each time you need an appointment? Oh, it's your neighbor. Okay, cool. Neighbor, you're up. You are integral to this team to get this child to term. So our original mission when we opened our nonprofit, our charity, was no one turned away. Because that way that meant we would not only get the mothers in, but we get whoever's with those mothers in as well, because they would feel the difference in that our welcoming and supporting from that open door policy meant that they could trust us. So it is in getting the supporters to understand the role, whatever it is, how small it is or how large it is, to have them understand the practical role. Like, for example, Faye's example, it was like, don't call me, here's the information, leave me alone. Practical, right? And then also to support them in doing that role fully so they feel empowered as well. Everybody wins. So it's a little bit of a heavy lift if you don't have these skills on your own, but it's not impossible. So that's how we do it.
Thank you. Thank you. Tanita, I see your hand up. So,
yeah, I wanted to say that as we begin to talk about this more and what that looks like, to consider, someone mentioned it earlier, another soror mentioned it earlier about, you know, the things that we do beforehand. No, they mentioned the outfits. About you said you said it. You said you needed some
they were bringing me
food,
outfits,
right?
not food. I
Right,
want
bring your
food.
outfits.
The
That
clothes
that
are cute.
reminded, absolutely. That reminded me. I'm a child of the '70s, so I feel like Jenny in some of these conversations. But we now everybody has these reveals. You know, we have 4 or 5 showers. You got the work shower, the sorority shower, the sister shower, the family shower, his side of the family, your side of the family, her side of the family, right? All these things. And we do a lot of stuff beforehand and we get a lot of things. We spend a lot of money on a lot of things. I want us to consider thinking about, when we think about building this community and our resources, think about maybe rethinking spending so much money on the front end and putting that energy and those resources into what we can provide for our sister, this mom, or any of the moms out in our community once the baby is here. You know, rethinking that, because we used to, back in the day, we didn't have ultrasounds and all those things all the time. Ultrasounds were saved for when something was wrong with the baby. Now we get it, it's automatic. People find out what they're having. But so we would have showers beforehand because we wanted we would have showers after it because we didn't know what the baby was going to be. We didn't even want to buy pink if it was going to be blue or all the things. Now we do whatever colors we want. But, you know, that thinking about waiting maybe, or have your shower beforehand, that's fine. But also think about the shower that's necessary afterwards, showering our sister with support and with love. So think about the post shower.
Thank you for sharing that with us. And I see Pearlyn just brought in her superhero baby boy. Hi, SJ. Hello, hello,
Miracle.
handsome.
I don't want to get us off topic, but he was
This is the
awake.
topic.
So he's
Yes.
like looking everywhere. Say hi, Sal's feeding.
Yeah,
Say hi.
he is the
He'll be
topic.
1 in January. Tell him how old you are. How old are you gonna be? He's
Yeah.
really 6 months, but how old are you gonna be? Come on. You gonna show him? How old are you gonna be?
Oh, hi,
He'll show you one.
cuteness.
Say hi. So I just wanted to
Oh my
speak, but
goodness.
and
Well,
support.
actually,
My husband has him while we're on the call. So
well, thank
say
you
see
for
you later.
sharing him with us. And he
Yes.
actually leads way to the next question. What has your
Okay.
experience been like to be a mother to a premature baby? Um, one, because this is your first child, so you didn't know,
Mhm.
like Faye had the opportunity to have Jacob first and then a preemie. So what has your experience been like, Pearlyn?
So for me, it was a roller coaster. We were in the NICU for 8 months. So I work, and you said it earlier as an operator, which means I work shift work. So I work days and nights, or I did work days and nights. So I would go to work where I live and where my job is. I would leave at 3:30 a.m. when I work the day shift. I work 12-hour shift. I was getting off at 5. And then I had to drive to Houston from Freeport. And y'all may not know that, but it's about an hour away. But with traffic, hour and a half, 2 hours. So I was having 18 to 20-hour days just to go to
Mm,
NICU. I went every single day. And when I was on nights, I would leave for work at 3:30 p.m., get off at 5 a.m., and I would either go see him when I got off work or I'd
mhm,
go before I went to work. So I had really long days and nights. As far as the care and just learning everything about the NICU, learning what the terminology was, learning what it meant to be intubated, extubated. For us, we had a big deal with him getting infections like UTI infections and things like that, which
mm,
it was very common, but he had 2 UTIs, and the third UTI, which I did not share this with a lot of people, but he coded. So Mother's Day, we went to visit, we were bottle feeding, I fed him. We started him early. He was born in 21 weeks, but he started taking bottles and doing a lot of stuff early. So Mother's Day, we went, had a good Mother's Day. We were bottle feeding, taking pictures, videos, doing all the things. And on that Monday, they called me at work. It wasn't his doctor. It was a doctor that has never had him, and said, "Your baby coded." I said, "What? What does that mean? Like, what are you saying? Is my baby alive? I'm at work.
mm,
I'm an hour and a half, 2 hours away at this
mm.
point. What does that mean?" And they said, "We're working on him right now." I'm at work, my husband's at work, my baby's in the hospital alone, and we don't know what's going on. So he was extubated at the time, which meant he didn't have the breathing tube in his mouth. He had it on his nose, and he actually came home on oxygen. So that's why he have these little dots. But he pulled it off, and we left it off. He's been fine. But so he had to get re-intubated. So we had them do tests. We had them find out what was going on. He had a UTI. So in his case, he had a hernia, which we noticed as he would try to use the restroom. He would vagal down, which like he's straining or pushing down. And I think it was causing discomfort. So at that time, this was May, we asked if they can wait, give him time, slow down, do not rush him, and find out what's causing these UTIs. So at that point, we started, my husband and I started researching, and we asked if we can just hold off on the feeds. But being intubated, extubated, he had several of those. But another thing that I did not share with a lot of people, because as I said earlier, I'm an introvert. I had my core group of people who I shared everything with, but he got a really bad infiltrate. And what that is when the IV burns you is in the back of his leg. That infiltrate caused it caused him to have a blood clot, and it caused him to need um shots twice a day, every day. It's a Lovenox shot to thin the blood or to dissolve the blood clot. He had that. He had to get like a normal burn patient would get like a skin graft. Well, they use something called a fish graft. So he got the fish graft and it closed it, but he has really bad scar tissue right now. We have therapy weekly, twice a week, and it's just a lot with him having to go through the separation of us not being there and him not being able to advocate or say anything for himself. That was a big deal for us. So I would say it was a roller coaster. We had several things that happened throughout the time that we didn't know about. So we really had to educate ourselves, but we had to advocate. And when I said my community came down, that's when my line sisters came, my family came, the ones that were aware, and they were very supportive. So being a NICU mom was a roller coaster, but in the end, having him home has been the greatest joy. And I'm still learning to navigate. I'm still learning to process things. And earlier, Miss Jenny said it. I never went through postpartum, never, because I never gave myself time to grieve. I don't know when it's gonna hit me or how it's gonna hit me, where I'm gonna be at when it hits me. But I never. I just went with the flow. Like I couldn't let myself get down because I knew that he needed me, and I had to show up every day whole for him. And not every day I wasn't 100% every day. Some days I was 20%, some days I was 5%, some days I was there, but I showed up every day regardless of how. I don't know how I made it sometimes. And every day I just showed up and tried to be there every single day. Um
Well, sometimes, and I share this
those
with Romanda, sometimes showing up is all you need to do and all that you can do. Um, and your presence can speak louder than any words. Oftentimes, and I'm like I'm a social extrovert, but I'm an introvert, if that makes sense. Faye will tell you, I know a lot of people, or people know me, but I don't really talk to a lot of people. um, but I'll show up. If you call me, I'm there. I'll sit in the corner and eat my little Chick-fil-A, but I'll be there. And sometimes that's all you need in your community is someone that can show up and just sit in the room and not even say anything. So Faye, what has being a preemie mom look like for you?
I forgot. I don't know if that's a testimony in itself. But I remember there was one midwife to say, when I kept on saying it, I think through my checkout, it said, look, you don't need to say it anymore. Yes, he was born early, but the way that he's progressed is just like any other child similar to his age. So I tend to forget that I gave birth to a child that was early, well, in God's eyes, on time. Um, and I even forgot about the hernia. I had a similar hernia situation where it, he had a green one, and so years down the line, I think 2 years into his life, that's when we had a surgery to correct that. But those sort of things like that, I was like, oh my gosh, I remember that. And looking back at the photographs when Google Photos remind you of that time, I'm like, I literally can't remember because of the way that he's developed. Now I do understand that other children have a different story, but God willing, it will still reach a perfect end in terms of that child. And if I was to bring him in now, I make way too much noise, I'm afraid. SJ seems so calm and collected. I was like, my being is Ezekiel. I named my child Ezekiel, by the way, which is God strengthens. It was so like it defined him so well in terms of the way that he came into this world. So being a mum of a preemie, I'm just a mother of two. So
Yeah.
I think literally there's nothing else I can possibly say on it than it being a testimony in itself in terms of his progress. And I guess it'll be his own story to tell. People have asked, is it hereditary because his father was premature? And I don't think it is it? Okay, great. You're shaking heads. Okay, I'll take it. Your word is golden. And in
What she
fact,
says goes.
yep. My husband, I forgot to say, my husband was a walking testimony for other mothers that was in the INCUBE. because there was other children that were born around the same time that he was, and you can see them being so disheartened and thinking, oh my gosh, I can't see a way out from this situation. And the doctor called us over and said, could you, like, you know, my husband speak to or show, you know, that he's healthy and well and so forth. Yes, there's been a lot of checkups in the early stages, but apart from that, it's totally fine. That gives reassurance to others that possibly couldn't be reassured. And one other thing, medically, I couldn't produce milk with my child. I don't know if it's Perilon, if it's the same with you. I couldn't pump because I couldn't hear the cry of my baby. So anytime I'm basically with my child, I can start produce milk. But when I'm not with my child, I just start to run dry. I know it's something to do with, is it pheromones? I don't know what it's, hormones or something. Yeah, so they gave me a drug to try and induce it, but in fact that can cause heart attacks. And like when I had the drug, I said this doesn't feel right, so I actually stopped it, and I just said, okay, fine, it's going to be bottle fed throughout this journey, and so be it. I didn't feel disheartened or discouraged or felt as if that I didn't I don't know, prove myself to my child. I was there. I showed up. Yeah.
Yes, sometimes, like I said, showing up is what's best. And my husband will tell you, like I said, I'll show up, eat my Chick-fil-A in the corner, but I'm gonna be there. Don't worry. I may be a little bit late, but I will be there. And I know you have to go shortly, Faye, so I do want to thank you for sharing your time with us and your story with us. Anytime I see your face, it's a ray of sunshine. Like I said, she was my mommy partner. We agreed to get pregnant together. Sounds
And you
crazy,
left
right?
me. You left me twice.
Yeah, I said yes. We'll both have babies together. We both ended up having boys together. Look, our first son's the 8 now together, and our second boy's 3.
I couldn't join you on that third journey, I'm afraid, hon. That 2 was my mark.
I tried to get her at 3, guys, but it didn't work out. But thank you so much for sharing your story with us. And like I said, it's always good to see your face and send my love to your family. But that leads way your question of, is it hereditary? What are some myths, Sora Joseph, that you kind of heard about premature babies and the stigma possibly around that?
Yeah, there's a lot of myths. One of them, I really just put that into one big category of blame the mother, right? Like, you did something. If only you had done blah, blah, blah. You're bad and wrong. Oh my gosh, right? The blame the mother shows up because it's a simpler way for the physicians to not take responsibility sometimes, right? Even when there's misdiagnoses, because there's often misdiagnoses. And there's a like, oh, well, you know, it's not mine, it's yours, right? You should have done. So we've tried very hard to dispel those myths. For example, I'll give you an example of, there's a certain condition in pregnancy where women have so much vomiting in the first trimester, or sometimes through to the whole third trimester, that it's called hyperemesis, you know, just vomiting, can't hold anything down, dehydration, you name it. Those women, and especially the ones that I've worked with, they have a wretched time with that. But yet they still seem to produce a full-term healthy weight baby. The worst person I ever worked with, who was in and out of the hospital with her hyperemesis till she was maybe 6 months along, she pushed out a 9-pound baby in front of my very eyes. And I'm like, okay, these are the kinds of reasons that I realized that if we can just dispel some of these myths, people will do better. And I use that example because you know how we are about nutrition. Well, you didn't eat right. Well, you didn't take your vitamins. Well, if you throw up for straight 6 months, so much so that you're hospitalized, yet you still produce a big old chunky baby at term, that can dispel anything that's being put on you about, well, your diet, right? So we don't need to buy into these tropes and negativities. We have to really just go back to the basics. Trust your body. Know your body. Report the symptoms early and be consistent. Don't let anybody tell you no. Because you know, no one knows better than you what's going on with your body. As well as in the postpartum, you know, a lot of the trouble we have with patients with being ill or, you know, dying in the postpartum is because no one's hearing you. These myths are that our bodies are broken, that we have problems, that Black women or women of color, Indigenous women, low income women, all of these myths are perpetuated to keep this system going the way it is. But you have to ask yourself, for millennia, what did we do? What happened? Right? We were fine. Right? So where there was loss, it was because of infection or, poverty or whatever, but it wasn't anything to do with the physiological process. We know how to have babies. And with support, we can have healthy babies. So it's really more about pushing this new thought of there's nothing wrong with you. We're here with you. Hold on, have faith, trust the process, versus this is right or this is wrong. This is true, this is not. There's so much misinformation out there. So much. So right now, we put out a recent guide for emergency birth for, folk in humanitarian situations where there's no one to support you delivering the baby. And I wrote it out that way because guess what? If you do nothing, you're still going to have a baby.
Yeah,
Right,
that's true.
Carolyn? The baby came out. Right? Did you have to do anything? Did you have to have the class prepare? The baby came out because that's what happens. And so the baby got itself in its right position, head down. Right? You see what I'm talking about?
Right.
So dispelling that inability for us to be able to manage this without somebody else telling us what to, it's not true. Because time and time again, we know what to do inherently. We know how to manage this process. And with support and love, we can achieve anything.
Very, very true. Pearlin, did you hear any myths or see any stigmas around having a premature delivery?
Yeah, so some of the myths that I heard were you're not gonna bond with your baby, like the baby and the mother isn't gonna be able to
What?
bond, or yes, so when the baby comes home, and my baby was in NICU for 8 months. So when he comes home, he's not gonna know you, he's not gonna want to be around you. That's a big myth, but for me, I was present every day. So he knew my scent, he knew my smell, my voice. I mean, he was gonna know me, and so that's totally a myth. Another myth that I heard was it'll take longer for them to catch up. My baby is 6 months based on when he should, well, corrected 6 months world for 10 months, and he knows how to say he's one, well, point or show that he's one. He's rolling over, he's on target for his age group, but he's also ahead in some areas. And being born at 21 weeks, I heard that he was going to have all these different complications.
Yeah.
It's very common to have like a brain bleed when you're born prematurely. He had a level 2 brain bleed, and level 1 and 2 are like the least severe of them all, but it dissolved itself. It's common to have like a PDA. It's where your heart doesn't close all the way, and he had a PDA, but I mean it's very tiny now. And just knowing that he's the first survival 21 weeker out of that hospital says that a lot of those myths that they tell you are not true. They can do more to intervene. And although they're a private hospital and they did it because they have that right, I think that his situation should show that if they intervene or try to do something, that they would give more babies a chance.
A fighting chance,
But
yeah. Yeah.
yes, and so I'm not sure how long it'll take him to actually catch up, but they say 2 years, 2 to 3 years is when they expect them to fully catch up. But I feel like if you work with them, that they'll be fine. It's gonna take a lot of work, but that was one thing that I heard. But the bonding, and like she said too, you already feel guilty. You already want to know, is it something that you did, what you could or couldn't have done? And so you do hear a lot of it's your fault. I've even been asked, what did I do to make my baby come early? And because I worked out, people thought that was like a reason why he may have come early, but that had nothing to do with it. My cervix was short and that's what happened. But I know you have other questions, but those are the big ones for me. Sorry, those are the big ones.
No, just the first hearing that you won't bond with your baby, I think is wildly crazy because I mean, people are surrogates. You have surrogate babies. So how do you tell a mother, although you didn't give birth to her, you're not going to like that's just insane. You adopt children. You bond with adopted kids the same way you will bond with your, biological kids. My husband himself, he was adopted. And you can't tell him his mama ain't his mama. That's his mama through and through. Um, no arguments there. Even my kids, they're like when they see how you do the family tree, they say, well, that's not dad's mom. So what? No, it's his mom. It's just a little reshuffled, but it's his mama. Um,
Mhm.
without a doubt. So that is just a crazy myth. And like you said, your son is dispelling any myth that that hospital might have seen, read, shared. Your son is proof of that, that there is a chance for children to fight. And if we give children the chance to fight, they'll prove you wrong time and time again.
Right,
Um,
they're tiny but strong. And even for me, like breast pumping and things like that, I still pump now. I still produce milk. So like not bonding, I didn't have a chance to do skin to skin very early on, which they said that helps promote your milk. And
mhm.
I'm still 10 months in. And by the grace of God, I'm still able to pump now. It's hard, but it's still flowing.
Yes,
So,
yes, yes, yes. And I said 6 months, I gotta stop pumping because this is a lot. I need I've seen this is a off the subject, but I've seen mothers go what 2, 3 years still breastfeeding. More power to you. More power to you. That determination that it's not in my wheelhouse. Um, but something else that you shed light on was they said that you working out could have enabled you to go premature. I don't know,
not for
Sir Joseph.
not professionals, but just people who aren't educated about what
Oh,
causes a
okay.
premature baby, right? Some of
Hmm.
the myths that you hear. So I wouldn't say that the professionals. My doctor assured me that it was nothing I could have done differently. The
Hmm.
situation was gonna be the situation, right?
Yeah.
But I think just educating myself and surrounding myself with people who have had children before that were able to educate me as well, and even people who have had premature kids before. And I don't take that lightly that they've had them, but having a 21 weeker and having a 30 weeker is a totally different premature child.
Hmm.
My baby's eyes were fused shut, his ears were stuck, like he actually grew outside the womb.
Hmm.
And we watched him, right? And so, um, you hear those things, but it's not the professional told me it was nothing I could have done or couldn't have done. He was gonna come either way.
Either way. Ooh, ooh. And I'm sure watching him grow outside of you was watching a living testimony. Um, and oftentimes you hear things, you go to church as a child, you hear, God did it, and you see the church mothers, giving praise and testimony. But to see that for yourself, to see a testimony for yourself, I think changes the way um, you are able to give your testimony. And I say that, and I'm so happy that we have Chuma, who is Faye's husband, joining the call, and he was preemie. And I wanted him to come in and kind of share a bit about his journey, what he might remember as a father to a preemie, even, and him being a preemie. So, Chuma, I think you're able to talk now, if possible. Let me see. Chuma, you there?
Yeah,
Thank you for joining. I'm so happy to have you here. So if you could share a bit about your experience, Chuma, I know you have to go quickly. Uh,
can you hear me? Can you hear me okay?
yep.
All right, perfect. Let me exit this because I've been trying to unmute. Sorry. When you're operating on a phone and trying to multitask, you know what they say, men can't really multitask. So I apologize. Can you guys see me all right? Let me see if I can get some
Yeah.
better lighting here. Yeah, so I was in the barber shop I've just come back from Birmingham, which is like another city in the UK. I took myself to a spa weekend. So
You
and I've
took
just come
yourself to a
barber.
spa weekend.
Yeah, I needed it. I needed it. Amani, I needed it.
It's
I
okay.
needed it. I needed a
I'll
break. I
forgive you.
needed it. No, I needed it. So I came on late because I was supposed to support my wife, but obviously I guess she's finished. And obviously it's Amani, so she's family to me. If you don't know, when they moved to London, we met them, and me and Charles have been brothers ever since, and like the whole family's all one. I was a bit upset when they moved back to America. I'm still upset that they moved back because they're supposed to be here forever. But sorry,
Same here.
let
Same
me
here. I'm
let me let,
upset too.
let me not digress and actually talk why I'm here. So I was premature myself. I was well, I came out at 6 months, so I was less than a bag of sugar. So in theory, I was 3 months premature, if that's the right terminology to use. In terms of weeks and all that, I don't know, not unless I look at my baby album, which has everything written down. What it was, I believe that I wasn't supposed to survive because later on I ended up having two operations on my foot, and I ended up being like a miracle baby where they put my picture in the hospital in the ward to say like I survived. But out of that, I guess sometimes I say because I have a neuro disability, which is dyslexia, sometimes I say, is that because of my being
Hmm.
premature? Is this the cause of it? I don't know. Nevertheless, I've always seen it as it's my super. Well, no, I'm lying to you. I haven't always seen it as my superpower. I've always seen it as I used to see it as a stumbling block going through
Hmm.
school and being dyslexic. Um, but now I see it as a super cape. It's who I am. It's what I am. I see things differently. I do things differently. It's part of me. And then going to the segment of having a premature child, it was it was difficult. It was difficult because it was the second birth. No, it was the second birth, but no wait, hold on. Second child, but third pregnancy. Because prior to that, we lost the child. And
Hmm.
our first child, Jacob Joseph, that was an emergency C-section. So there was a few traumas on my side that I didn't know existed until I had my second child, Ezekiel, who the I don't know, you maybe heard from my wife, but I guess you want to hear from my perspectives. Um, from a husband and from a father and from a head of the home, it was very difficult for me to go through lockdown and not be able to be in any antenatal classes or any single appointments where I'm able to hold her hand and reassure her. So I was always getting information secondhand, or
Hmm.
she would call me and have the phone while there's talking to her, so I might be able to listen to one or two things. But just the whole aspect of the pregnancy and everything what went through. So I don't know if she's explained it. What initially happened is her waters broke early. Now, both of my sons, they're 4 days apart. So her waters broke, I think, either the day before my son's Jacob's fifth birthday or the after. But every day we had to keep driving to the hospital for them to scan her and check her out.
Hmm.
And then I never forget when he actually came. I remember her telling them the baby's coming, and I guess they didn't believe her. But then he came, and um at that particular moment, because it was COVID, I wasn't allowed in the theater until it was active labor. Sorry, my phone keeps blurring. I wasn't allowed in the theater until it was active labor. So when it he did come, they kind of took over, and
Hmm.
I just remember seeing a clock and doctors all around him working on him to help him breathe.
Hmm.
I remember praying to myself, saying, God, I'm not giving this woman a corpse. So whatever you need to do, you need to come through because it's not gonna happen. And then when I heard him cry, it was like, whoa, okay. Then it was like, bam, they just carted him off, put him in the incubator and whisked him away. And what it was is once I left that room, I wasn't allowed back in. So she's just given labor.
Hmm.
It's all quite traumatic for me. He's not been able to breathe. He's breathing, bang, he's in the incubator, bang, he's taken to ICU. And she's like, go with him. But in my head, I'm like, what about you? But I have to leave.
Yeah.
So I've gone. Well, now I've left that room, the labor ward, I can't go back in. So what's happened is when I've gone into the ICU, I'm just hearing all manner of machines bleeping up. Beep, 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 beep. All the doctors are running around because they're all intensive care babies, all ICU babies, all in incubators. Then they're running around. Then they're like, yeah, we're transferring him. I'm like, huh? So I'm like, all right, you need to transfer him to the hospital closer to us. I'm not trying to go to the hospital inside the city because there's congestion charge, all of that. So they transfer him. I phone her, I say, listen, they're transferring him. She's like, she's discharging herself. I said, what? So she
Mhm.
discharged herself. We leave the hospital. Bearing in mind, in my head, I'm just thinking, is this woman okay? Because how do I know the placenta's been come out of you? How do I know you haven't ripped out? There's bare things going in my head, but she's got some next level of strength where she's just like, I need to be where my son is.
Mhm.
So we've driven to the hospital, and I remember how I left him. He had all these tubes in him. He had all this stuff in him. He just looked like something out of a zombie film. To be honest, it didn't look like a child. He looked. I was
Mhm.
scared. It
Mhm.
was a traumatic experience for me. I've left. We've gone to the other hospital, parked up. We've gone in, so and so and so, and then literally he's in another incubator. He's in another ward. I see. It's more a bit calmer. There's a few more nurses that are able to explain everything. But I'm already shattered.com because every day I haven't been able to sleep. We've been back and forth, back and forth. I've been up and down, up and down. So I'm just running on fumes. And then it was finally time for us to like leave the hospital. And that's when it really hit me. I remember calling my brother and crying and saying, I can't take my son home.
Yeah.
I have a car seat with my oldest son. How am I going to explain to him that his brother's not here? He's here, but he's not here. And having
Mhm.
to explain to him, you can't see him either. So your brother's born, but you can't see him. And I remember that time, um, my sister was still alive. I sadly lost her in 2020, that 6 months after he was born. And she was the rock because she took care of my younger son. She sorted everything out. She's the person I called when she was going through, when Faye was going into labor. And she just came around and sorted everything because my mum's deceased. So my sister stepped in. But
Mhm.
yeah, it was hard because thereafter it was you making the trips to the hospital. And then I'm having to call work and say, all right, cool, I need to take my paternity leave now because my baby's early, and then sorting all that out with pay and all this rubbish and rubbish. And yeah, then just managing the world after that, family, and explaining to them that he's premature, no one can see him, we can't see him, but we're going to the hospital every day because Faye's having to produce milk and pump it and then go there and drop it off. And every day I was seeing him, still wasn't able to take him out. Whereas when Jacob was born, I I had Jacob on my chest. I had that bonding time. And I was able to, but for me, for part of me was like, he's so frail. I don't want to hurt him. I don't want to carry him. And then, before I know it, day by day, he was getting stronger. He was putting on weight. Then before I
Mhm.
know it was time to discharge him, and then we took him home, and then 3 years have passed now, and I wouldn't think you wouldn't see this boy think he was a premature baby. Sometimes you want to just slide tackle him and take his legs off because he's a bit cheeky, you know.
He's a
But
typical 3-year-old.
yeah, that you need to, you know what I mean. They need some reprimanding sometimes. But
Oh,
that's my experience from a husband, from a father's viewpoint. And yeah, sometimes I guess as a man, you also go through the labor, but it can hit you differently. Like you may not go through postnatal depression, but the weight of the shoulders on your world, the managing expectations to make sure your wife is okay, make sure the home is still functioning.
mhm.
And in honesty, I'm quite an active father.
Mhm.
And yeah, it was just that season I was in was a very difficult season because I had a lot of mental things to comprehend and just be able to
Yeah.
understand that, driving a car and you don't have your child in it. And then people see you and like, oh, congratulations. And then it's like, yeah, he's in the hospital.
Yeah. Yeah.
So, you know what I mean? There's all of that. And, but, we thank God, we're here today
Yeah.
and, he's free, he's bubbling, he is what it is. We thank God. But yeah, that's just my 2 pence. I hope you've been able to understand my accent and sometimes my slang and my ad libs, my London twang, as they say. But yeah,
No, thank you for sharing, Chuma. And I told Faye, anytime I see her, I always find anytime I see you, it brings back happy memories. Like
yeah,
Chuma said, him and my husband met first and they became brothers, like inseparable. I'd say, okay, Charles, let's go. He's like, okay, let me call Chuma and see if he wants to come. Dude, I just want to hang
yeah,
out with you.
yeah,
There he was like, no,
yeah,
Chuma and Faye, you gotta come. We gotta run the
yeah,
streets of London together, with
yeah,
the
yeah, yeah,
boys.
yeah.
So
Remember
they
we went
definitely,
Southend?
yeah.
Amani, yeah, yeah, we went there again, and I thought of you guys, but you put us on that basically that trip to Southend.
Really? Oh,
Yeah,
look, I'm happy to do that. I'm happy to do that. We built a strong community in London, and I'm so happy and so fortunate that you were a part of it. And thank you
I
for
want you
sharing your
guys back.
story.
I
Thank
want
you
you
for sharing
back.
your story.
I want you to
We'll be
come
back
back.
soon enough. We'll be back soon enough. Thank you for sharing your
All right.
story and sharing your testimony. And I tell Faye, it's a conversation I don't think I've had with you guys for the simple fact of how triggering it could be and can be,
Mm,
but thank you for being so vulnerable. And not a lot of guys want to talk about something so traumatic, like you said, being the head of the household and having the weight of everything fall on you.
mm.
You tend to retreat inward and not,
Yeah, yeah,
want to share. So thank you for
yeah.
opening up. And I look
Mm.
forward to giving you hugs and giving
No,
my little
definitely.
nephew some hugs when I see you
Yeah,
guys.
definitely, 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 definitely. Guys, thank you for having me. I really do appreciate it. And I'm gonna drop out now. But yeah, I can't wait to see you all again whenever you do decide to come back to London, Amani and Charles, wherever you guys are.
Yeah.
But yeah, we're family. So if you see me, if you guys are Amani's Kappa family, you lot are my family too. So whenever you guys are in London, you can hit us up, and I'm more than happy to take you lot around the town.
Thank you,
Yeah.
Chuma.
All right, Amani. Love you.
So Chuma actually gave way to what does preemie birth do to our community? That's how I want to close this out. What does it do to our community? And what can it help build within our community? So Sora Joseph, if you can go ahead and share your thoughts and opinions on that.
Yes, no, the answers are within our community. There's no one else coming, sadly. This will continue so long as it can. And so when I tell you, and I mean this, in all with as much humbleness as I can find, we already figured it out in our practice. There's no one that has been able who works on prematurity, March of Dimes, all the different research, everybody's out there fighting for. We're trying to get to the answer for prematurity. We are convinced the answer for prematurity is being supported, being in community, being heard. The amount of mothers that call me with, I've got blood, I've got a funny pain, I think I'm leaking. We get right on it. We fix it. We get right there, and they go on and have these babies at term. So they do that because they know the support is there, that we're at the end of that emergency line. If they call, we will answer. If they come into the clinic and tell us, we will believe them. So if we build out our community of support, look at that relationship that Chuma and you just, in plain sight, we can all feel that tangibly. That's support, that's a relationship, that's a community that's in place. It seems really odd to say it because we're talking about a physiological process where the baby is expelled from the uterus early, but yet I'm here to say the baby will stay in the uterus with that support. And then there's always going to be those cases where there's nothing anyone can do. Literally, there's a reason, such as a cervix that will not hold without a cerclage, but at least getting a cerclage in on time solves the problem, right? So never just depend on, we're waiting on someone to come up with a medication or a special technique as the only way to solve prematurity. No, it is literally in our hands. We can do this right now. We can all start tomorrow morning. We can stand with each other, with our families, with our communities, and we can literally eradicate this one disparity that plagues our communities. Prematurity does not have to exist inside of love, inside of support.
I love that. Let's just hold that. Premature does not have to exist inside of love and support. That's it right there. That's it. Pearlyn, how has this impacted your community
I will
that
say
you've
from
been?
the beginning, it's like you don't know what you need until you have to need it.
Mm,
And I'm a person that's a giver, and I'm a person that's always trying to see the silver lining or the positive side of things. And I remember saying, God gives his test to his strongest, or he gives his battle to his strongest soldiers, right? And I feel like in having a premature baby, I realized that what I needed, and I realized that it was okay to say you need help. I realized it was okay to not be okay, and I realized it was okay not to always be the strong person and to lean on the people who are willing to love on you. And that's always been a problem for me because I've always been the person that people needed. And I felt like I needed to be there for people. So even if I was stressed out or going through something, I didn't let what I was feeling be a feeling
mhm,
because I wanted everyone else around me to be okay. Because I knew that I could, if it was money, I knew I could hustle or sell my clothes or go to work. I knew I could get what I needed. And I think looking back, it came from a fear of the lack of
mhm,
growing up, right? You learn how to survive. You learn that you're going to do what you need to do. So now you're worried about the people around you who may not have those same instincts or who may not have that same willpower. So I realized the people that you know are there, but you don't talk to them every day sometimes
mhm,
become your most support. The people
mhm,
that you think aren't going to be there, be there. And the people you think will be there, won't be there.
mhm,
So I just really learned who I was and who to let in my space. And that's really helped not only me, but my child too. And so I realized that the community of people I needed were positive energy, positive people, people who actually spoke life and not the people who are going to come and usually they're bringing their problems. So I had to say, you know what? I can't help you with your problems. I have my own. And I'm still learning. It's not easy because 40 years you're this person who, have always been that giver or that person that wants to help everybody. So I will say now uh, even social media, like my community there, I make sure I pour into them what
mhm,
I didn't have and I try to educate them. So
mhm,
it made me be more of an educator and an advocate because I think about the people who have premature kids who have a language barrier or I was fortunate to
mhm,
not have other kids at home, but being in the NICU there were people who were coming who had other kids at home or they couldn't make it like Faye said earlier the distance, people were driving hours away, they didn't have money to park, you have to pay to park, they didn't have the finances to park. There were things that I noticed that we were fortunate to have that other people did not have. So it really made me want to educate others. But I surrounded myself with a community of women and they've been like my rock.
mhm,
I'm a Delta, so it's like some of my line sisters, some of my big sisters, some of my sorors, just they've been very, very, very instrumental in this.
mhm,
And I actually had to listen to them. Like I had to take their advice. Some have kids, some don't, but I had to respect everyone and what they had to say because I knew they had my best interest at heart. And
mhm,
I will say honestly, if it wasn't for them,
mhm,
I probably wouldn't be on this Zoom right now. I probably would be somewhere stressed out. And then my sisters, my family, and I'm just saying my local community opposed to like the whole broad spectrum of it, but it
mhm,
starts at home and that's where it starts at. And I've even had people tell me because of our situation they've even started to take care of their kids better, like they've really witnessed a miracle right? So I would post things on social media, but it would be positive. If you read the quote, like I always try to have a message behind it. Like I never post anything that's gonna just make someone feel like negative energy, right? So I
Mm-hmm.
was very protective of my energy. And
Mm-hmm.
being that I was protective of my energy, I was protective of who I let in. But it really has made me build a community
Mm-hmm.
with SJ to show people. And I'm a firm believer that it doesn't matter. You may not have a premature child and your story may not be my story, but we're all going through something.
Mm-hmm.
And you can learn from me, I can learn from you. So if you really think about that, think about the main goal at hand. What's the main goal? The main goal is to lead, inspire, teach, educate, advocate. And that's the biggest thing, like showing other women you can advocate for yourself, you can advocate for others, you can be there. So my community has definitely been it's been, well, my journey, I'd say, has definitely been me being vulnerable
Mm-hmm.
and really allowing people in my space that I know care for me, even though I may not talk to them every day or all day, but and just weeding out the people that don't need to be in my space,
Mm-hmm.
protecting my energy.
Thank you. Thank you. Thank
You're
you all for
welcome.
sharing. I want to give time. Are there any questions from the chat as we wrap up this conversation? I want to also thank everyone for tuning in. This conversation and childbirth in general, I think, is one that I love to sit in and hear from. Even with 3 kids, each of my delivery stories are very different. And this last one being the absolute craziest story. I ended up with preeclampsia. Uh, they thought I was going to stroke out and die, but I'm sitting as I'm talking with you all. I was talking like that with the doctors, and they're, doing whatever doctors do. My husband ended up cursing out a few staff members, which probably wasn't the best thing, but he knew, seeing the numbers, that something was off, even though I was acting like nothing was wrong, right? So having that person to advocate for you, as Sir Joseph mentioned earlier, it's vital. Even when you can't advocate for yourself or don't think to advocate for yourself, because I'm thinking, I have a minor headache. That's normal. I'm under stress. That's normal. But seeing those numbers is not normal. And my husband knew something had to happen in order to save my life. So having that community, first and foremost, is important. But if any one on this call knows anyone that's pregnant or needs support in any way, be that person to support them, or give them resources to find support. Sora Dillon will tell you she's team no kids, but she can't tell you that she's not a part of someone's support team. That woman will call you and text you every day. Hey, you okay? Did you eat today? What we talking about? She'll call, did you watch Love and Hip Hop? Just random nonsense, but it's a part of showing up. So be that support system to others, but also make sure you're taking care of yourself in that process. Like Caroline said, protecting your energy in your space, because childbirth and it's a very emotional time. Um, your hormones are already all over the place, right? So you don't want to add to the craziness by inviting other craziness, right? So Sir Joseph, did you have any final thoughts that you wanted to share?
No, I just think this was really such a powerful meeting. Again, just acknowledging everybody, whether you spoke or didn't speak, ask a question or not, that I know whenever we're in this space, when we're talking about ourselves, our children, our families, our communities, that we feel it and we get that messaging. It's not just the verbal, it's the sensed, embodied work that happens. The shifts show up in this kind of exchange, and that all of us are qualified to be of support. All of us are qualified to receive support because we're human beings, and that we ground everything in that. We will never have to wonder, well, I don't know how to do it, so I can't. Yeah, you can.
Mm-hmm.
Just listen.
Mm-hmm.
Just show up. Just be there. take care of yourself, model,
Yes.
show from how you are being, how you can be there for somebody else. So this was really powerful. I'm so grateful that I was able to be a part of it. Thank you so much for inviting me. It just means a lot.
Thank you. Thank you for saying yes and engaging with us. Um, you, what I said earlier, Faye, which you say goes, right? She said it, so it must be true. I don't gotta fact check that. Thank you so much. Perilyn, did you have any final thoughts that you wanted to share?
Yes, I would just say thank you so much for having me and the power of social media, right? That's how you found me.
Yes.
So thank you for even considering and thinking of me. But I will say, had I not shared my story, like you wouldn't have, you know, known
Yeah.
that's what happened, right? But I will
Hmm.
say this to whoever is listening: a person does not care what you know until they know that you care. And I live by that. You can be the most educated person, you can have all the knowledge in the world, but if you don't show that you care, what you know means nothing, because there's so
Mm,
many people that are hurting and there's so many people that actually need love and support, and sometimes your education may not be what they need.
hmm.
Sometimes just a word saying you're going to be okay, or a word that's saying that it will be all right, and I think you said it earlier, they were being bringing clothes by or different things by. I realize when you have a baby, sometimes you just need somebody to come and wash dishes, right? You need
Mm,
somebody to
yes.
come and do the laundry. You need somebody to
Yes.
just come and let you take a bath, let you take a
Hmm.
nap. I
Hmm.
didn't know that. My baby's been home for 2 months. He had an eight month NICU stay, so he's a little more active than what he may have been if he was 1 or 2 months or something
Hmm.
like that. But the biggest takeaway is everybody's hurting from something, and we don't know what somebody else is going through, and you
Hmm.
cannot judge a book by its cover. You don't know what the next person is going through. It's like a backpack. When I was a teacher, you have all these different kids come in, until you start taking things out of their backpack to see what they're really packing. You don't know what they're going through. So you just have to show up every day and realize that a person does not care what you know until they know that you care, and that's the motto I live by.
Oh,
Thank
thank
you.
you.
Thank you so much for
Thank
having me
you.
too.
Thank you. Thank you for sharing. I want to turn back over to Sora Dillon. I believe she has a few announcements, and then I will let you all go. Go ahead, Sora Dillon.
Just two announcements for everybody. One is our virtual Christmas social, which is a bingo night. So come try your luck with some Amazon gift cards and everything. That will be December the 9th. And we have our Sigma brother DJ West Wills will be on virtual ones and twos, providing some jams through the evening. So come join for that. But also, if you are in the mood to come to London, the best time to come is March the 11th through the 16th, when we are celebrating 10 years of being finer in England. It is our chapter diamond anniversary. We're turning 10, and it's a big celebration, a week of activities. Even some of our prominent like nationals and regional people will be there in attendance. So we are excited as we gear up for that. So come join us for tea, some afternoon tea, and other activities through March the 11th to the 16th. If you are interested in either one of those, you can contact us. So those are just two announcements we had on the horizon for our chapter.
All right, thank you. And thank you all for sharing again. I honestly, like I said, I could talk about maternal health for hours. It's become a very soft spot for myself. So I look forward to seeing more conversations about this within our sorority and with you, Sora Joseph, especially, and you, Miss Bell. Come on and share your
Thank you.
story. That's how I found she shared her story on social media. I was a customer of hers. She shared her story, and I said, "Oh my goodness, you don't know what people are going to until they're willing to share." So thank you for sharing. your journey and story with us. I appreciate it. And with that,
Thank
I'll let you all enjoy the rest of your Sunday. Thank you all for your time. Y'all
thank
enjoy
you.
yourselves. You're
Bye.
welcome. Bye.
Bye.